Hello everybody. We are talking about the role of probiotics, beneficial effect in breast milk, and we must talk about a study which was on breast milk, and this study was done in part of Germany and Austria on the lactating mothers. On our discussion, we have to talk about the digestive comfort and the role of probiotics with beneficial effects connected in breast milk. If we look at the brief synopsis, breastfeeding is an important way to give your baby both dense nutrition and physical comfort. Another benefit of breastfeeding is that the friendly bacteria that colonizes a mother's gut is passed from a mother to a baby in breast milk. When a mother is taking probiotics, there is evidence that these good bugs can help to strengthen a baby's immune system and may be useful to treat or even prevent colic, allergies, and atopic skin conditions like eczema. And from it, we have got a learning objective, and those objectives are: the human body is home to approximately 100 trillion microorganisms with over 400 diverse bacterial species. You can support healthy gut bacteria by eating fermented foods like yogurt, kimchi, kombucha, kefir, and miso. You can also take probiotics in supplement form, including capsules, powder, or liquid. The benefits of regularly taking probiotics are numerous and include protection of the gut from the bad bugs, along with preventing or treating leaky gut syndrome, a condition when the intestinal barrier becomes permeable, potentially leading to a development of food allergies and autoimmune disorders. Healthy gut flora also plays an important role in digestion, regulates metabolism, and makes up more than 75% of the immune system, according to the acupuncturist and practitioner of integrative medicine, Chris Kresser. Now, let us talk about the gut health and immunity in breastfed babies. Newborn babies rely almost exclusively on breast milk to provide immune protection from their environment, at least for the first few weeks of life. Breastfeeding for the first weeks and months of a baby's life is an important way to ensure a healthy balance of friendly bacteria in baby's gut. Since the gut is the center of 60 to 70% of the immune system, inoculating a baby's gut with probiotics through breastfeeding is an important strategy to strengthen a baby's overall immune system. If a mother has gut dysbiosis, gut flora that is out of balance, then baby's gut will also be colonized with unfriendly bacteria. Taking probiotics is an excellent way for mom to strengthen her own gut health and pass on these friendly bugs to her baby. Now let us talk about probiotics. Definitely, I think you are interested to know what probiotics are. According to WHO definition of probiotic bacteria, these are live microorganisms which, when consumed in adequate amount, confer a health effect on the host. Probiotics includes a whole range of completely different microorganisms endowed with different properties and effects. Some of the mechanisms behind the beneficial effect are valid for all the genera and strain of Lactobacilli and Bifidobacteria. Many properties and effect are strain specific. If we look at the effect of probiotics and how it acts, we find that induction of dendritic cell maturation is done by probiotics. It is behind the enhancement of serum antibody response to orally and systemically administered antigens, and it enhances immune reactivity of splenic cells and phagocytes. It is behind the activation of the gene for human beta defense in intestinal mucosa and induction of oral tolerance to beta-lactoglobulin. It is behind the production of beta-galactosidase for improvement of lactose intolerance, and it is behind induction to reduce local inflammation in the gut. Now we have to know how can the same probiotic strain help with so many different functional gastrointestinal disorder. The gastrointestinal tract is not just a digestive system, it also houses the body's largest immune system. It is the gut associated lymphoid tissue, and it is the enteric nervous system of the body. If we look at our GI tract, anatomically we can divide it into stomach, small intestine and large intestine. Stomach contains a large number of bacteria, approximately 10 to the power 3 per ml contents, and many of these are Helicobacter pylori. Then our small intestine is there, which numbers bacteria approximately 10 to the power 4 to 10 to the power 6 per ml contents, and most of these are Lactobacilli and gram-positive cocci. And our large intestine, numbers of bacteria are there of approximately 10 to the power 12 per ml contents, and these are bacteroids, Bifidobacteria, Clostridia, Streptococci, Fusobacteria, Lactobacilli, Enterobacteria, Enterococci, and Eubacteria. There is a fourth organ in the gut also, and these are the gut microflora. It influences the maturation and regulation of the functions of all three organs systems through direct effects, as the gut flora is still subject to important changes at the age. When we talk about probiotics, Lactobacillus reuteri is a very important microorganism we have to know about. These are the organisms which produce compounds that exhibit antagonistic activity, that is reuteri, cycline, which are water soluble, broad spectrum antimicrobials, effective over a wide pH range, and resistant to proteolytic and lipolytic enzyme. What do we know about the effect and mechanism of L.reuteri? It modulates gut flora, it modulates the immune response and inflammatory responses in the gut mucosa. It promotes postnatal intestinal neuronal development, thereby furthering gut motility. It inhibits visceral pain coming from the gastrointestinal tract and decreased tonic contraction of the muscles of the colon caused by pressure, and it normalizes disturbed sleep pattern. How does L.reuteri modulate gut microbiota? It temporarily colonizes the gut and increases their number after ingestions. It ferment easily fermentable sugars to produce energy. During this process, they produce lactic acid, which reduces the intraluminal pH value, and the acid molecules inhibits the growth of potentially pathogenic bacteria in the gut while promoting the growth of Lactobacilli and Bifidobacteria. It complete with potential pathogens for nutrients and the attachment sites for docking onto the gut mucosa. It produces a L.reuteri, that is 3-hydroxypropionaldehyde, an antimicrobial compound. L.reuteri is active against a wide spectrum of gram-positive and gram-negative, for example, E. coli, yeast, fungi, and viruses. It kills the pathogenic bacteria, whereas it doesn't touch the good bacteria. The direct contact of other bacteria such as E. coli stimulate L.reuteri production or secretion. L.reuteri inhibits bacterial growth by inducing oxidative stress in the bacterial cell. L.reuteri itself is highly resistant to the effects of L.reuteri. Here is a comparative study in comparison to other probiotics and effects on pathogens. Many of the organisms are mentioned here, like Listeria monocytogenes, Staphylococcus aureus, Beta-Cereus, E. coli, S. typhimurium, S. flexneri, and Yersinia enterocolitica, and all these are studied in comparison with many of the probiotics, and it's found that L.reuteri has got a very effective effect on these pathogens. This is a comparative study which shows the effect of probiotics and their effects on different pathogens, and many of the probiotics are on this trial with many of the pathogenic organisms, and it's found that Lactobacillus L.reuteri produce a real effective role in control of those pathogenic organisms. Another of the probiotics which is in use now and showed a lot of benefit out of it is Bifidus lactis. Bifidus lactis is a very powerful transient probiotic bacteria. Scientific studies have proven that Bifidus lactis enhances immunity, fights tumor growth, improves digestion, and can lower cholesterol. Bifidus lactis inhabit the intestines and the colon in great numbers. Generally, their job is to break down body waste and aid in the absorption of various vitamins and minerals. Bifidobacterium lactis is present in raw milk and is used as starter culture for cheese, cottage cheese, and buttermilk. The benefits of Bifidobacterium lactis: it fights cancerous tumors, improve digestive conditions, oral health from Bifidobacterium lactis, enhance immunity, reduce allergies and inflammation. It can be used in management of diabetes, and it improves cholesterol status also. More benefits are like it fights cancerous tumors by increasing tumoricidal activity. It improves digestive conditions by improvement of general digestive comfort, decrease intestinal permeability, decrease lactose intolerance, normalize bowel movements, decrease IBS symptoms, decrease constipation, and treat acute diarrhea. Oral health from Bifidobacterium lactis are also there. These decrease cavity causing bacteria in the mouth from salivary mutants, fight dental caries. It enhances immunity, reduce frequency and severity of respiratory disease, increase vaccination immune response, increase immunity among the elderly, inhibit Helicobacter pylori, which causes ulcers, increase T cell activity as needed, strengthen the immune system, and reduce colds and flu. More benefits which we find are it reduces allergies and inflammation by decreasing atopic dermatitis symptoms and sensitivity, decrease inflammatory response. In diabetes management, it increases blood glucose control and improve cholesterol by decreasing total cholesterol and increasing HDL cholesterol. We find that from our studies that Lactobacilli and Bifidobacteria in human breast milk is present, which influences Antibiotherapy and other host and clinical factors. Human milk is a source of live Staphylococci, Streptococci, lactic acid bacteria, Bifidobacteria, Propionibacteria, Corynebacteria, and closely related gram-positive bacteria to the human gut, mainly the infant gut. Several studies have shown that there is a mother-to-infant transfer of bacterial strains belonging at least to the genera Lactobacillus, Staphylococcus, Enterococcus, and Bifidobacterium through breastfeeding. In fact, human milk constitutes one of the main sources of bacteria to the breastfed infant gut, since a baby consuming approximately 800 ml per day of milk, which would ingest between 1 into 10 to the power 5 and 1 into 10 to the power 7 bacteria daily. It has been suggested that exposure of the breastfed infant to such a wealth of bacterial phyllotypes through breastfeeding may exert beneficial effect against several diseases. Breastfeeding has been shown to improve infant health outcomes, lowering the risk of respiratory and GI tract infections, necrotizing enterocolitis, otitis media, and allergic diseases, and to prevent later health problems such as inflammatory bowel disease, obesity, and type 2 diabetes mellitus. Now, we look for a study which was done in part of Germany and part of Austria, and these were on lactating mothers, and the study was from the breast milk taken from these lactating mothers. Method was of taking a total of 160 healthy women participated and provided a sample of breast milk. Women were recruited to cover a moderately wide area of Central Europe from randomly chosen regions in Germany and Austria to represent southern and eastern Germany and western and eastern Austria, parts of both countries, which included both rural and urban settings. This study produced a statistical analysis, and from it a quantitative data were expressed as the mean and 95% confidence interval of the mean were shown when they were not normally distributed as the median and interquartile range. A correlation analysis was performed to test the relation between bacterial counts in MRS cysteine and somatic cell counts. Proportions were compared using X-square statistics. Differences were considered significant and was used to carry out the analysis cited above. This slide shows a graph of bacterial and somatic cell counts, and here the bacterial counts in MRS cysteine and somatic cell counts in breast milk are shown here to show the correlation between both the parameters. This slide is to show bacterial identification, and here we find the total viable cells, Lactobacillus and Bifidobacterium, and their presence in the breast milk. This is another one which shows the bacterial identifications, and what we find is most of the microorganisms are from the probiotic groups, mainly Lactobacillus and Bifidobacterium lactis. Here we see Lactobacilli and Bifidobacteria diversity in the milk samples. Presence of Lactobacilli and or Bifidobacteria DNA in breast milk samples as determined by species-specific PCR, frequency of detection of DNA from genus Lactobacillus and or Bifidobacterium lactis. This is a slide which shows the Lactobacilli and Bifidobacteria diversity in the milk samples, and these are done with the DNA of Lactobacilli and Bifidobacteria present in the breast milk samples, and these were determined by species-specific PCR. Frequency of detection of DNA from genus Lactobacillus and or Bifidobacterium and Lactobacilli and Bifidobacterial diversity in the breast milk samples are determined by PCR using species-specific primers. The 52 different combination of DNA from Lactobacilli and Bifidobacterial species detected by PCR in individuals. So, from this study and many of the other studies done in the past decades, we can come to a conclusion. And the conclusion is that it is clearly demonstrated the complexity of gut microbiota composition and the modulatory effect played by several endogenous and exogenous factors on it. Type of feeding in the first month of life appears as one of the most important determinants of the child and adult well-being, and its protective action seems to rely mainly on its ability to modulate intestinal microflora composition at early stages of life. In recent years, the implementation of milk formula with probiotics, prebiotics, and lactoferrin has been demonstrated to change newborns' microflora composition toward breastfeeding pattern and stimulate immune response. At the same time, no definitive results are available regarding the real health improvement, so that breast milk, whose beneficial health effects are undoubtedly unique, has to be considered the food of choice for infants in the first 6 months of life. For the same reasons, breastfeeding should be encouraged, and At the same time, new researches are advised in order to better define the composition of intestinal microbial ecosystem and the specific interactions amongst diet, microbiota composition, and health of our children. Thank you very much.